Okay, we're going to continue now with the second part of Module 5D with the discussion of pancreatic cancer. Okay. So at the end of this module, you should be able to understand the major signs and symptoms of pancreatic cancer, as well as be able to identify the clinical stages of pancreatic cancer, and then be able to discuss approaches for screening and treating pancreatic cancer. Okay. So pancreatic cancer, which I've already shown you before, the statistics are pretty grim. So the 5-year survival rate for those that are diagnosed with pancreatic cancer are still quite low. So here you can see from 2004 to 2010, about a 6.7% 5-year survival rate. Pancreatic cancer accounts for about 2.8% of all new cancer cases, but it disproportionately then accounts for about 6.8% of all cancer deaths. So because pancreatic cancer, and we'll discuss this more in this lecture, is harder to identify until it has progressed and spread beyond the pancreas, it's much harder to treat once a person is diagnosed with it. And this is what contributes to this really low survival rate. And again, I pointed out before that we really haven't seen an increase in this 5-year survival rate statistic, in the past 30 years. And a lot has to do with the fact that it's very hard to identify pancreatic cancer until it's too late. And really based on, the function of the pancreas, as well as where it's located, what it's near, treating it becomes much more difficult, which you'll see. So again, the prevalence of this cancer, about 1.5% of all men and women will be diagnosed with pancreatic cancer at one point in their life. So again, it's not the most common kind of cancer, but it does disproportionately account for about 6.8% of all cancer deaths. Okay. And so what is the pancreas? And so just as a reminder, the pancreas is going to be located in the abdominal cavity behind the stomach. And it's an important gland that's part of both the digestive system as well as the exocrine system. And so its role in the digestive system is that it's going to be responsible for the production of a number of important enzymes that help us break down food. And these are going to travel from the pancreas into the first part of the small intestine. The pancreas is also part of the exocrine system, and it functions to produce a number of very important hormones that are used to regulate our body's metabolism. These include insulin and glucagon, and so without these particular hormones, we would not be able to regulate our blood glucose levels, as well as provide our cells and other body systems with the energy they need to function. So the pancreas is a very important organ. Okay. And so pancreatic cancer is cancer that obviously arises in the pancreas. And most pancreatic cancers are going to be exocrine tumors. And so this means that they're going to be formed in the exocrine tissue present in the pancreas. There also are, much less common, pancreatic neuroendocrine tumors. And these form in the islet cells. So you might remember that the islet cells are what's responsible for producing insulin in the pancreas. And so you can look at this figure here where you can see this cross-section of pancreatic tissue, where you can see that it's composed of both exocrine cells, and those are going to be the cells that more commonly become cancerous and give rise to pancreatic cancer. But you also can see that the pancreatic islet cells, or the endocrine cells, also can become cancerous and give rise to those neuroendocrine pancreatic cancer. Okay, and we'll revisit that a little bit later on. Okay. So what causes pancreatic cancer? There really hasn't been a lot of studies that have shown this definitive cause for any sorts of genetics or any sorts of other inherited syndromes that are related to pancreatic cancer. Some studies, though, have shown that there are particular risk factors that increase your chances of developing pancreatic cancer. But again, these are going to be things that you see as being risk factors for a number of different types of cancer. So the first one is going to be smoking. Smoking has just consistently been shown to not only increase your risk of developing lung cancer, but also other types of cancer, including pancreatic cancer. People with diabetes, you might imagine, are at more increased risk of developing pancreatic cancer. And again, diabetes is going to be tied to this loss of either insulin production in type 1 diabetes or insulin sensitivity in type 2 diabetes. Okay, family history can also increase your risk. Again, there are no known sort of genetic syndromes that are associated with pancreatic cancer, but having a first degree relative that's had pancreatic cancer does put you at higher risk of developing the disease yourself. Okay. The other big thing that we see, and which you probably could imagine from previous discussions, is that inflammation of the pancreas is directly tied to increased risk of developing pancreatic cancer. So those that have pancreatitis for over long periods of time, so again, you have this inflammation of the pancreas, you're going to be putting those cells at increased risk of, becoming cancerous. That's going to be directly tied to an increased risk for developing pancreatic cancer. And again, obesity is also a risk factor. So what are the signs and symptoms of pancreatic cancer? So early cancer of the pancreas, soon after it has started to develop, it usually doesn't cause any noticeable symptoms. And this is what makes it very difficult to detect pancreatic cancer at its earliest stages when it's most treatable. When the cancer starts to grow beyond the pancreas or grows quite large, that's when individuals typically notice the more common symptoms of pancreatic cancer. And these include things like dark urine, pale stools, and the yellow skin and eyes that are characteristic of jaundice. And so jaundice occurs when you have increased levels of bilirubin in the bloodstream, and that can arise if you have obstruction of the biliary tract, and that could be caused by this large pancreatic tumor growth that could, block this off. And so a lot of people do present with jaundice with that characteristic sort of yellow skin tone, yellow in the eyes. Okay. Also, you'll have pain, so pain in the upper part of the belly or pain in the middle part of your back that doesn't really go away just by sort of shifting your position. Nausea and vomiting can also be common, as well as floating or pale colored stools. And again, these are going to result from the fact that typically once the cancer has started to grow in the pancreas, it's going to obstruct normal pancreatic function. Okay. Advanced cancer can also cause these sort of more general symptoms. So weakness, feeling tired, loss of appetite, or significant weight loss for no known reason. And again, the weight loss is going to be because you're going to have a lot of malabsorption or other metabolic consequences because the cancer is going to start to compromise pancreatic function, as well as the organs that are located close in proximity to the pancreas. Okay. These symptoms may be caused by pancreatic cancer, but again, they're pretty generalized types of symptoms. And so people that are seeing these signs and noticing that something is off, they really want to consult a medical professional so that they can sort of figure out what's actually going on. Perhaps they have another medical condition and it's not pancreatic cancer. But being evaluated, always trust your gut. If something's feeling off, if something, doesn't seem right, make sure that you follow up with a doctor. Okay. So screening and diagnosis. Again, we talked before with colon cancer that screening is key. So being able to, start regular screening once you turn 50, you can catch cancer quite early for colon cancer. This isn't really the case though with pancreatic cancer. It's very difficult to detect and diagnose early, in the early stage 1 where you have the best chance of treating it successfully. And it's difficult for a number of reasons. Again, we just talked about that there aren't really any noticeable signs or symptoms in that very early stage of pancreatic cancer. This is in contrast to the fact that very early colon cancer is going to cause that melena, or the presence of blood in the stool that can be detected by that fecal occult blood test, that non-invasive test that can be done in a doctor's office. You don't really have that option with pancreatic cancer, and so typically you are detecting it at a much more advanced stage. And so it's also complicated by the fact that, if someone develops jaundice or they're having these other symptoms, they're a lot like the signs and symptoms of other illnesses. So the medical professionals might, think that something else is going on and it might be misdiagnosed. And so the pancreatic cancer, once it's starting to cause, these signs and symptoms, it still won't be caught because it does look like a lot of other, illnesses. Okay, and this is also true because just the location of where the pancreas is. It's really hidden behind all these other organs in the abdominal cavity. So it's behind, the stomach, the intestines. You also have the liver, the gallbladder, the spleen, and the bile ducts. So again, it's much harder to sort of detect it even when it starts to grow and the tumors are relatively small in size. Okay, so once pancreatic cancer, though, has been diagnosed, staging becomes important. And so I'll walk through the different stages of pancreatic cancer like I did with colon cancer. Okay, so stage 1 is when the cancer itself is confined only to the pancreas. And again, it's very rare that pancreatic cancer is actually detected in this early stage. But if it is, it has a much higher rate of successful treatment. Okay, so in stage 1A, the tumor is quite small. It's less than 2 centimeters. In stage 1B, the tumor itself is over 2 centimeters in size, but again, it's completely contained to the pancreas. Okay, in stage 2, the cancer is already spread beyond the pancreas. And in stage 2A, you see that the cancer has spread to nearby tissues and organs, but not in the lymph nodes. And then in stage 2B, the cancer has already spread to nearby lymph nodes and may or may not be in the nearby tissues and organs. Okay. In stage 3, you'll see that the cancer has spread to the major blood vessels near the pancreas. Okay, and again, this is going to be important because remember, one of the big problems with cancer is once it metastasizes, it moves, outside of its original site and spreads beyond. And so once it's spread to these major blood vessels, it becomes a much higher risk that it will start to move, beyond this portion of the abdominal cavity. Okay, and then it's staged at stage 4. So stage 4 pancreatic cancer, again, is going to be more of a systematic disease now where the pancreatic cancer has spread to other parts of the body. So it's spread through the lymph, it's spread through the blood, and it's started to cause tumor growth in other organs, and it starts to affect other organ systems. Okay, and so we've already said before that survival rates are quite low overall for pancreatic cancer, but they do differ a little bit by stage. So again, remember I said that most pancreatic cancer is going to be exocrine, so occurring in those exocrine cells in the pancreas. Okay, if you catch it early in stage 1, you have about a 14 to 12% 5-year survival rate. And this drops all the way down to only about 1% once cancer is discovered at stage 4, so this very progressed pancreatic cancer. Okay. I did say before that the pancreatic neuroendocrine tumors, so those that arise in the islet cells, have a much higher rate of survival. And if you catch it early, you have about a 61% 5-year relative survival rate. Although now by stage 2, if you catch these tumors then, once they've spread beyond the pancreas, they become much harder to treat. Okay. And so what are your treatment options with pancreatic cancer? Again, keep in mind that the pancreas is an extremely important organ. Not only does it have very important digestive functions, it also has this very important exocrine function. So it's producing hormones that you need. You need insulin, you need glucagon, you need these other important hormones that it produces, as well as you really need all these digestive enzymes that it's responsible for providing to the digestive system. And so once the tumor has sort of grown in the pancreas and it's causing, pancreatic function to decrease, you're going to have a lot of complications. And so even though surgery is a very, it's sort of the standard of cancer treatment where you want to go in and remove the cancer, it's very hard to go in and just remove the pancreas and to have, to be able to sort of treat it that way, because losing all pancreatic function can be quite hard to deal with. Okay, and so the most common treatment for pancreatic cancer is something called the Whipple procedure. Okay, and the Whipple procedure is going to entail going in and removing a large part of the pancreas, but leaving behind a small amount that's just enough to produce all of the digestive juices and insulin that you need to support normal body function. Okay, but you also go in, but in addition to removing part of the pancreas, you also remove the gallbladder, part of the stomach, part of the small intestine, and part of the bile duct. And the thought here is that because pancreatic cancer typically has spread by the time it's detected, that going in and removing all of this surrounding tissues and organs, that you have a better chance of treating the cancer as a whole and removing much more of it. But again, do not think that this is a simple procedure. This is something that's very hard to recover from and also very risky. But the benefit to this is that it does save a part of the pancreas that can support, again, those very important functions that it provides. Okay, when that isn't an option, you can go in and remove the whole entire pancreas, again, along with with nearby portions of the stomach, the small intestine, the bile duct, the gallbladder, and the spleen, and any nearby lymph nodes. And so that's, a very extreme measure, and then, these individuals have very specific nutrition concerns now because they basically do not have the digestive function that they used to, as well as the hormonal function, and so they needed to be treated, for loss of that. And so, it's not a very ideal option, and it doesn't really lead to the best quality of life after that's done. As well as potentially sometimes you can go in and remove just some portions of the pancreas, as well as typically the spleen nearby. So a lot of times you're unable to treat the cancer itself with surgery, but surgery is often used to treat symptoms of pancreatic cancer. Because again, once the pancreas is compromised, the surrounding organs and tissues, you're going to have a lot of digestive function impairment. And so a lot of palliative surgery can be used to sort of treat these, very painful symptoms and sort of improve quality of life in pancreatic cancer patients. And these include things like biliary bypass. So if bile is building up in the gallbladder because of obstruction in that area, bypass can be important to make sure that that bile can sort of drain either into the stomach or the small intestine. Gastric bypass can also be very helpful if you have food is, the movement of food is starting to become blocked in that area. That's a way to sort of take the stomach and sew it to the small intestine to sort of provide another pathway for that food to move through. And stent placement can again be very important to help treat symptoms because again, things like bile, you saw with jaundice, you're having this increase in bilirubin. A number of different stents could be placed to sort of give other options for these things to flow through that system once the cancer growth has sort of compromised the entire, that typical digestive system flow from the stomach, down through the small intestine. Okay, but again, these are really treatments that aren't so much treating the cancer to try to remove it, but sort of treating the, very painful and significant symptoms that are caused by cancer of the pancreas. Okay, other treatments can be helpful, but again, you see with the 5-year survival rates that the options that we have now are very limited. So chemotherapy is always an option. So trying to shrink, to target those proliferating cells and shrink the size of these tumors to typically sort of prolong the lives of individuals with pancreatic cancer. Radiation also can be useful. So again, this more targeted approach for trying to target, particular areas where the pancreatic cancer has spread to. But again, when you think about where the pancreas is located, what its role is, and what it's adjacent to, radiation can be very tricky and it can have very significant side effects. Okay, there's some promise now with more targeted therapies, so the use of tyrosine kinase inhibitors are going to be able to block the signals that those tumor cells need to grow, and they've shown a lot of promise for particular types of pancreatic cancer. And so a lot of times there's a recommendation for those with pancreatic cancer to get into some sort of clinical trial where they could have access to the most new, the most cutting edge cancer treatments in the hopes that they could receive something that could prolong their life far, much longer than the traditional treatments. But again, I think a lot of people recognize that based on, the function of the pancreas and when you have that compromised by cancer growth, as well as the fact that you typically find pancreatic cancer so late after it's really started to spread and cause severe symptoms, that again, the treatments that are available are less effective. So what you saw in colon cancer is that finding it early, going in and removing it surgically, you can treat things, very well. You're not going to have it reoccur as much, and you're going to have much longer survival rates in those patients. Whereas pancreatic cancer, typically it's caught at a very late stage. The sort of chemotherapy, radiation, those traditional tools, as well as surgery, are going to be less effective. And so I think that sort of illustrates why you haven't seen in the past 30 years those 5-year survival rates increase too much. And so I think moving forward, better screening options, potentially the identification of particular biomarkers or other risk factors that put people at higher risk of developing this type of cancer, would be really important from a public health perspective to try to step in and prevent to sort of step in and make sure that we catch this particular cancer as early as possible.